Welcome to Inside Out, Mental Health at Work and in Life, where we're exploring why our workplaces feel the way they do and what it takes to build cultures that support genuine well-being. I'm your host, Catherine Eady, and today I'm joined by Dr. Raja. Welcome to the show. Before we dive into the topic of mental health at work and in life, though, for people meeting you for the first time, could you share a little bit about yourself?
Thank you so much, Catherine, for inviting me for the podcast. I'm Dr. Raja Gangopadhyay. I'm a consultant obstetrician and gynecologist, and I'm the obstetric lead in perinatal mental health at West Hertfordshire Teaching Hospital NHS Trust.
Thank
Uh,
you. Sorry, I was going to say
no, no,
that.
no, please,
Carry
please.
on, carry on, Raja.
Yeah, thank you. So I am in this role for over 10 years now in this particular role. Yes, I deal with mental health issues, and it is so great to talk to you to share my experience.
Excellent, great. So, kind of kicking off with a very kind of broad question, but ultimately from your perspective and your area and line of work, when you think about a mentally healthier workplace, what do you think that actually looks like in practice for your community and that you support?
First of all, it is quite individualized feeling. The first and foremost, in my view, is what the employee feels when he or she goes to the workplace, and whether he feels or she feels that their aspirations, their needs are looked into, taken care of. From a medical perspective, what I feel is that often when they are going through difficulties, their manager and their employers in general, they should be listening to their concerns. Often, in my experience, what I've seen, that it is definitely possible in many cases to nip the thing in the bud when it is actually developing. But what I see in practice, that often it is not addressed at a very early stage. And that is what I feel needs to be done. Prevention is the key, in my view.
Yeah, absolutely. And that's a lot of the work where we're trying to focus on. But I think you and I are like in that space where we're finding that it's very reactive.
Absolutely.
It's very much responding at the point at which people are significantly struggling, not listening much earlier on for those maybe more subtle things going on for people,
Absolutely.
which is absolutely key. So leads us nicely on to kind of where do you think organizations are getting stuck right now, given that it is pretty reactive and we are not, many employers are not stepping in until a much later stage in people's health and well-being.
Hmm. First of all, I don't think it is true that employers are not doing things. I have done my another background I have is that I'm a NHS clinical entrepreneur. So I had the privilege and opportunity to work with and speak to a lot of businesses from different size, from very small to medium to large corporate sectors. They are willing to do because they want a healthy workforce. They want a workforce who which is productive, which is well healthy, because if the workforce is stronger, the businesses will thrive. So they want to do, but often they are not sure exactly what's the approach is. um, I actually did personally wanted to know exactly what's wrong and where exactly things are they're stuck in your words. So I spoke to over 20 companies, specifically large corporates, specifically those who are very keen to health and well-being. So what I spoken to their managers, their leadership team, specifically to explore a bit more. So I interviewed about over 20 companies. So what I have realized that they are doing everything, but often it is they are not talking to each other, the measures they are taking. For example, they have occupational health, they have health insurance, they have HR well-being teams, and different other activities they can participate in. Often there are online GPs.
Mhm.
But the problem is that once you have the different approaches, and if there is no more cohesive and a comprehensive approach, it's very difficult to address those issues. When your health is actually interfering with at your work. I mean, I, as a clinician, I see the work and health in a slightly different way. What I have seen in my experience, that health can have an impact at work, and work can have an impact on health, and we have to create that right balance. Now, when the health is in a state which is affecting your work, that means it is in a most of the time is quite advanced stage. So we need to approach it in a more sensitive and individualized way, rather than having, yes, it is nice to have all the policies and contracts, everything in place, but at the same time, it is very important. Sometimes you have to take a step back and see whether actually meeting your individual needs of the employees at different levels. In my view, when I talk about prevention, I mentioned earlier, whenever we talk about prevention, in general, we often feel that stopping things from happening in first place. But in general, in medical science, we see prevention in 3 different stages. And it is never too late to intervene. This is very important. Now, when we talk about prevention, in general, we often think it is primary prevention, when actually nothing has happened. Otherwise the individual is fit and healthy, and we are trying to do something like different lifestyle measures, etc., to prevent things from happening, to improve their resilience, both physical and mental. So that is primary prevention. Secondary prevention is, to me, is the most important thing, is early detection and treatment. You may have, and this is if you can intervene at this stage, you are most likely to get a lot of benefits. And for this reason, how you can do it is mainly through different screening approaches. And the third one is tertiary prevention. And this is exactly what you said earlier on, that or we were talking about, is that when things have actually gone wrong, quite advanced stage, and we are trying to firefight things, and we don't know exactly. And this is exactly, still it is not too late. In medical terms, we call it tertiary prevention. So essentially what we are trying to do is to rehabilitate that individual so that he or she is properly supported, and they are actually reduce the sickness absence. So it should not be just targeted towards some business data. Like often I see that, oh, well, my business is being affected by, filling the sickness gap, etc. But if we have a more human approach to this, it is definitely possible to retain that staff. And because they are actually maybe very experienced member of your staff. And if you lose, we know, I'm not going into detail, that, there are different costs involved. But if you look at the cost benefit ratio and return on investment is definitely higher in my experience. So, but again, it needs planning. It needs more leadership and a different approach, in my view. So we have a slightly different blanket approach to health and well-being at workplace, which to me is they are investing in health and well-being, but it needs to be done slightly in a different way, in my view.
That's an interesting viewpoint, because what does investing in actually mean? That's the big question, isn't it? And I think what I kind of heard from you as well, is the huge mix of where people are at on those different levels. And employers, will have people at those different levels, from the anything going wrong, to the prevention in terms of the second level and the third level. And I think maybe employers are just struggling with the how a bit more. Need that further guidance and support. I think employer support is, you can have the employee support with all the employee assistance programs, occupational health, but who's supporting the employer as a business with this? And obviously we do have employment legislation and changes coming in, but again, when people see those changes, they go, okay, who's supporting the business with those changes that then have an impact on the health and well-being of their employees? So maybe there's quite a bit to unpick for for businesses, and they're facing, certainly what the work that we've been doing, the other pressures at the moment seem to be much more of a priority with everything else that's going on.
Mm-hmm.
So how do you balance this space with all the other stuff that they need to attend to? It seems to be a big challenge as well.
It is definitely challenging, and this is exactly where you need to take a step back and see what is working, what is not working. Now, when I spoke to the different businesses to explore where actually they are struggling, why it is not working out. And investment, you asked a very important question, what do we mean by investment? Actually, here I am talking about investment means actually investing money here to improve the health and well-being, i.e. Getting into different contracts, getting different employee assistance program, etc. So I'm actually talking about the real money, because at the end of the day, it is a business. They need to survive in, as you rightly said, it is a difficult world. So many things going on all around the world. So it is difficult for businesses too, but they are, as I said, that is their priority. And every time, in fact, I was talking to one of our senior managers in my trust, and they said that, Dr. Raja, I need two things from to improve this, or take this organization forward. So what he said is that I need health and well-being, and I need innovation. Unless we are excelling in these two areas, an organization cannot progress or develop or stay in this competitive world. And I think that is the solution. So you need to bring in innovation in health and well-being space in the businesses. Now, I have been thinking through it. I have been consulting many businesses, and what I feel, it should be a clinically led intervention at some stage that focuses on identifying them at a very early stage and throughout their journey, and creating a space where they can talk about their health and well-being much openly. Specifically, when I talk about my experience as a consultant obstetrician gynecologist, as you know, often there are stigma. In spite of the fact that we are in a developed world, we are in a very educated society, but still their stigma exists, sadly, both in pregnancy, that is antenatal, and intrapartum, postpartum, and also in gynecology. They hesitate to talk about it. They hesitate to talk about with their family members, their friends, their colleagues, and that is exactly where things go wrong often. So they suffer in silence. If they're having difficulties, no one to talk to. Many patients come to me and say, Dr. Raja, I'm not sure whether you will listen to my concerns, whether it is affecting my health and well-being. Yes, I am having period problem or pelvic pain, etc. in my gynecology clinic, but I'm also going through other difficulties as well, because I can't concentrate. I cannot focus. It's keep me so stressed. I don't know even when my period is going to start, how heavy is going to be, how significant pain is going to be, or when the period is going to come. I don't know. Sometimes if they have irregular bleeding or having menopausal or perimenopausal symptoms. So we first of all need to see, what I always do in my practice is to listen to them and explore to what extent their quality of life is being affected. Often we fail to understand that one, because when we try to listen to their concern, and sometimes rightly so, we are in a busy environment in the clinics. We do not have time. The GPs do not have time. Consultants do not have time. We are all busy. But again, we need to take a step back and listen to them. And the same thing with the managers, their line managers and colleagues. If anyone is coming to try to tell something, just sit down and listen. You will find out most of the time things are addressed at the right time. But if that individual cannot express how they are feeling, how the health and well-being is affected, then we cannot win. And this is how you will see that diagnosis is delayed, delayed, and delayed. So in my view, the solution to the problem is bringing in clinician at a very early stage and in an innovative way. And I don't know, we have time. I can take you through what I mean by that. I don't know if you have other questions to ask, or are you happy for me to sort of tell you right now?
We can go any which direction. I mean, obviously, I've got kind of the questions there, but I just want to pick on a couple of things before you
Sure.
do carry on.
Thank you.
One thing that just came out there was quality of life, that term quality of life. That's really, really interesting because I'm thinking about government policy, the messaging from society and health and well-being. It's quality of life is mentioned often at the older, we've got more people, is it 50 plus, I think, living longer, but have a lower quality of life. So they're living longer with ailments over a certain age. And we talk about quality of life, but actually, you've just made me think about we never talk about quality of life in the workplace. I've never heard that term used in a
Mm,
workplace context. And yet it still applies, quality of
100%.
life. That is it. The other thing that came to mind when you were speaking about, particularly around gynecological issues, is I think the lack of, and it's knowledge as well, the lack of knowledge of the wider impact of those. You touched on that with, pain, but, even we're thinking from a point of concentration and focus you mentioned, but you could bring in so many other impacts on sleep,
Mm,
on, when you're arriving into work late
mm,
because you've had to deal with something gynecologically in the morning.
mm, mm,
So then you're rushing. So your body is in that fight or flight already arriving at
mm,
work. You then don't know if you're going to get through the whole day at work
mm,
because you're in pain, because you're tired, because of this, because of that.
mm,
So I think from what you said there is that the underappreciation of the ripple effect of
mm,
that particular problem,
mm,
an issue, a gynae issue that someone may have,
mm,
the much wider, actually, but I think we forget just how
mm.
widely that affects other areas of people's lives.
This is absolutely spot on. If you look at, if you just think what exactly an individual goes through. Now, we spend most of our important time of the day at work. I'm not saying, different businesses are different, but in majority of cases, if I just take the 9 to 5, so-called 9 to 5 job, so that is a most important part of the day we are actually spending at work. So obviously, as you rightly said, that if it is affecting the rest of my day, I could not sleep very well. Often in many health cases, that is an insomnia is a very important factor, and that becomes a vicious cycle. So you are not productive at work. You are coming home with after a very so-called stressful day, and then you cannot relax at home. Sometimes people do different things to cope with their symptoms, smoking, alcohol, so on. So
Mm.
that actually impacts your health. So it can be a vicious cycle, but it is definitely, with a very sensitive and approach, it is definitely possible to intervene and break that cycle. And it is important to work with that individual, what their everyone's needs, perception towards life and how it is affecting so-called quality of life is different. And quality of life, you cannot isolate workplace with their life outside their work, because often you will see that our very best friends, maybe one of our colleagues or one of the members of the team. So sometimes when we even finish our work, we may sometimes go and socialize with them at times. So it is a very integral part of our life. So we cannot isolate quality of life. And as you rightly said, often we do not talk about quality of life at the workplace. I I have seen, probably this is one of the perceptions we need to overcome and educate employers. And if we try to appreciate that, definitely things can start changing.
Mhm. Yeah, absolutely. So continuing with what you wanted to bring in, do carry on.
Mm. So, as I said, in my view, first of all, when we talk about health and well-being at workplace, in my view, although I'm a bit biased because I work in, as I said, I work specifically focusing on mental health and well-being on specifically during and after pregnancy. But obviously, first thing one we need to really appreciate is a sort of life cycle approach. So, for example, if you are just starting your work after university, or maybe sometimes people start even quite early. Now, if if I am that individual who is going to join a company, it is no brainer. I would like to work in a place where my health and well-being will be taken care of as I move throughout my life. Because at the moment, maybe I'm just having some period related problem, and as my age advances, or I'm thinking about having a family, then I may have infertility issues. I'm not sure whether I'm going to be able to, what is wrong with me to get trying to conceive. Then when I'm pregnant, then I may have some other difficulties. I give birth, then I don't know whether I'll be able to come back to work, whether I'll be able to cope with the childcare issues.
Mhm.
And then when I grow a bit older, I may have menopause and perimenopausal issues. And even after that, the thing doesn't end. Then we may have more increased risk of certain gynecological cancers as well. So it is a life cycle approach. So whenever, first thing we need to appreciate that we need to be able to create a workplace where at different stages they are able to talk about this. So as you rightly said at some point, is education is key. And education doesn't necessarily mean, sometimes I've been asked to talk to different workplaces. And what I see is that, who joins, usually the employees, and maybe some line managers or individuals from HR. But I insist on having education for the executive team, the leadership team, because unless they appreciate this one, we can keep having a lot of discussions, but will never change actually. So this is very important that we educate everyone from the grassroots level to the senior leadership team. Then things will change, in my view. So this is very important. So education is a very important part of it. Now, the second one, what I always believe in is involvement of senior clinician at a very early stage. Now, what I mean by that, as I said, that it is nice to focus on primary, secondary, and tertiary prevention, but we specifically need to focus on the early detection and treatment bit. And this is exactly where the different screening programs are useful. And what I mean by that is many individuals, they don't even know that they have a problem. They may have ovarian cyst, they may not know, or they may have actually going through some other difficulties like perimenopause, menopause, they may not know. So it is very important to have a screening test or some kind of screening program in women's health, which I haven't seen it in. Maybe there are some isolated example, but it is not very generic, and not all the big organizations are working on that. Maybe some support for menopause, perimenopause, etc. But I think at every life cycle, stages of the life cycle, it is very important that we can do a lot of screening procedure to find out that different screening tests can be arranged. And I think that should be done annually. So that is the first thing, because when things are still in a subclinical stage, but you can identify and address them. This is number one approach. Number two is that we know that it is not going to change overnight, that stigma and shame attached to it when they find it difficult to talk to their line manager or colleagues about their symptoms, unless it has advanced and they do not have any choice but to talk about it. So in my view, what should happen, there should be some kind of a third party intervention where anyone with that, if they're having any symptoms, instead of going to the line manager, they can come and talk to a clinician who has a very good understanding of their workplace and the situation they're in, and that can be signposted. Again, I do not see them. So they, for example, they may have private GPs. I've seen in many companies, they have subscribed to the private GPs, but they may not have. So if, let's say, for example, I'm having period pain, so I go and speak to the GP online, and they give some medication, but that is not addressing my overall day-to-day life. So you need somebody who can understand your business, who understand the entire business, and able to talk to them. And then that clinician, and that should be, in my view, maybe a consultant who can liaise with different and signpost them at a right place, and can work as an intermediary with their line manager or HR, that look, this is in our radar, and I think that needs to be addressed at a very early stage. So that bit is missing. So essentially what I'm talking about is that you may have different benefits, employee assistance program and GP, etc. But if we can put together something that talks to each other, like for example, maybe that is what my preferred model is, that there is a consultant or senior clinician, or maybe it may be a senior nurse, an experienced nurse, or someone with a very good health and well-being knowledge and at a very good understanding of the business and that particular individual workplace. So any employee can approach them, and they assess and then signpost, and they sort of support them, or maybe work as an advocate so that they can talk to them. But that, in my view, that should be a third party, because I have seen, what I'm actually sharing, what my patients come and tell me because I have special interest in looking into this, and I often specifically ask them that if they're at work, if they're working, that how it is actually affecting work. So what they said that, yes, Dr. Raja, I have a health and well-being champion, one of my colleagues is, but he or she is still a part, or they are still a part of that business. So I am not sure whether I'm disclosing something, although they are saying that yes, it is definitely confidential, but actually I don't know whether some gossip is going to start at my workplace, or is it going to be, if I say share anything in confidence, whether it is going to be escalated. I don't know whether I'm going to lose my job or not. So I don't know. So I personally feel it should be a third party where they have confidence in talking and addressing and appreciating that one, and identifying and addressing at a very early stage. So intervention at an early stage, I cannot emphasize this enough, how key it is. And throughout my career, I qualified as a doctor in 2000, and since then I have seen at every stage. I have worked in India, I have worked in the UK, but I think the reason it is UK is definitely so advanced. Still, we have work to do. Wherever we have intervened early, like screening test, for example, you can see that screening test for cervical cancer, actually it has really worked. Screening test for breast cancer, it has worked. So if you focus on that one, and you can have a more those kind of approach, I think definitely it is going to work. When we talk about, sorry, please feel free to stop me. Sorry.
No, well, I was just thinking when you were talking there around, something popped in my head a little bit earlier on around the underutilization in workplaces of occupational health.
Absolutely.
And it's been talked about a lot, even at government level, that it almost seems to have disappeared from workplaces in more recent times, the underutilization. Now, occupational health for larger organizations, as I'm aware of, is external, or can be external. It's interesting to think about what that could look like for a business, but I've also been part of working for very small organizations, and there are discussions going on for SMEs about how occupational or any type of support would work for smaller businesses that don't have departments, that don't have HR. I've worked for plenty of organizations that don't have HR. They don't have, they even from an employee assistance program, it's not in place. It's a case of, if you need some support, we'll pay for 6 counselling sessions. So I guess it's what does that look like for, the questions for people listening to this podcast potentially, it's like, what does that look like for me? And I think the discussion needs to be, how do we bring that to fruition, and how do we make sure it can work for no matter what size of business you are, what structure, where you're based, whether you're private, public sector. Obviously, public sector is under huge pressure financially. How do they bring that kind of thing in? And then we have the third sector that also struggles money-wise to think about screening and these kind of interventions. So it's a very big topic to unpick, isn't it? Because we have to really think. I think it goes back to the word you said earlier, innovation.
100%. Now, this is a very important, and thank you very much for bringing that in. Occupational health skills and expertise, in my view, is underutilized everywhere. Often people feel that occupational health is just an assessment. So when you are actually in having a problem, we arrange a session with an occupational health clinician, and then they will just have an assessment, and then they will tell you whether you are fit to work or not, or whether some reasonable adjustment needs to be done. But they cannot actually treat you. So this is very important so often, I have spoken to a lot of occupational health clinicians, occupational health nurses and physicians. They say that, look, I have done an assessment, and if you probably have a better idea than me, they have a very holistic assessment, and they're a very better place to do that assessment. They understand your business in and out. But the frustration is that they know that something needs to be done. As you rightly said, they will probably, the employers probably fund for few sessions, but actually their problem is not going away. And you may have it's better than not having anything.
Yeah.
But I think occupational health is underutilized, that expertise, because they can intervene and help in both and all the different stages of prevention, primary, secondary, and tertiary prevention. But sadly, they are only involved when things are not going well, and they are sent for assessment and asking for reasonable adjustment, etc. But I think this is, in my view, the model I was talking about is that to have a multidisciplinary approach is very important.
Mm.
And getting the help from a senior clinician and HR with expertise in people and culture and occupational health, having those three forces working together can make a huge difference, because clinician cannot do everything. Occupational health assessment is very important, and also the support from HR is important as well. That people and culture approach is very important, because they will provide the strategic direction about how culture change in culture can take place. Because what we are essentially talking about, to change in the culture, change in the perception, education, etc., they all need to work together. So that particular multidisciplinary approach, I think, is missing.
Mm. I think certainly from experience so far, they can often be extremely separate, and they don't talk to each other. And there's a huge amount of learning that could evolve if they did do that. Had that more kind of connected cohesion, and as you say, multidisciplinary approach. So often it is about the communication as well, the communication across the organization, across the different people involved in health and well-being. More recently, I've kind of had a few concerns around it only sitting with certain individuals in often quite large businesses and companies, and I'm thinking that individual goes, they've lost a significant, not only the key person that was leading on it, but all the knowledge and background they have about the business has gone. Someone else needs to pick it up, but they're starting from way back from the person that was leading on it. So that, for me, at the moment, is a little bit concerning. It's sitting with just a few people, and that's not great.
Absolutely agree with you on this. Also, specifically, there are a few other issues which I think is not properly understood. One of them is, I know there are a lot of intervention and a lot of support available for addressing mental health and well-being at workplace, suicide prevention, etc. But often we fail to understand that there can be other triggers, specific triggers, which can make your mental health worse. We started talking about that initially at the early stage of our discussion, that having a biopsychosocial model, because they are, if you look at the definition of WHO of health, they take into account your physical health, mental health, and social well-being, and that brings to your quality of life. So they are all interlinked. So you cannot have a great mental health without your physical health and social health, and vice versa. So they are all interlinked. So these three pillars of health needs to be addressed if you really want to have a healthy workforce. So going back to your first question, what do you mean by health and well-being at workplace? So first of all, I want it to be this three areas of health needs to be addressed at every health and well-being assessment. So like for the reason I wanted to point this out, because I see specifically with regards to pregnancy. Now, there is this is a vast topic. I'm not going into detail, but you might have heard about perinatal mental health. So that is any mental health condition from the first day of pregnancy up to now they're talking about almost 2 years of childbirth.
Okay.
So this is a specific area that cannot be just generalized with other mental health and well-being. And there also comes a very important aspect is a father's mental health. Father doesn't necessarily mean that male individual, but anyone in that particular role. It can be the same-sex partnership or anyone in that particular role that can have an impact on their mental health. That is often not clearly understood, and there is a very clear evidence. Unfortunately, the main data is on male, that is a father's mental health. But in my view, in my experience, I've seen anyone in that role, that can have an impact on their mental health. They may have gone through, might have witnessed their partner going through labor, pregnancy, their traumatic experience. They might be traumatized, and that can have an impact on their mental health and well-being in their future life. And I see it every day, and this is misunderstood and undervalued. In fact, I have recently seen someone whose partner is a healthcare professional, and they understand it extremely well, or they have very good understanding about the health and well-being, but they are suffering and they're seeking help, and that individual needs to be encouraged to seek help. So that aspect often, so you can very well offer them some counseling session, etc., but why they're having, often that trigger factor often not addressed. This is very important. The second part is that the mother who is pregnant or have given birth, or within 1 or 2 years of their childbirth, they are very high risk to develop mental health problems. Often there is a denial because mental health problem can start for the first time, and that can happen without warning. Again, when I talk to people and when they're referred to my clinic, often they say, Dr. Raja, I don't know why my midwife has sent me to this clinic, because I thought that perinatal mental health problems happen after giving birth. That is, they might have heard about baby blues and postnatal depression and postpartum psychosis, thanks to the media. But we often fail to acknowledge that mental health problems can happen equally during pregnancy as well. So, and if we often, these are not properly addressed or discussed by the maternity staff, they also need education. They are not properly supported at work. That can have a significant impact. Simple example, I'm not, so just imagine a mom, she's otherwise fit and healthy. So she's pregnant and she's at work and she's coming for her antenatal visits, etc. That is fine. So employers are supportive, but the baby developed some problem. Maybe baby is not growing very well. So midwife is worried that she's measured and she's measuring the baby's the fundal height, and midwife thinks it's not growing very well. So what is happening? What will happen next? That she will need more scans. Now she will need more extra appointments, more visits to the clinics. Now she is innocent. She is just following what the healthcare professionals are telling her. But it is very difficult to sometimes convince the employers that she needs extra visits. It looks like she's just making it up and trying to find an excuse to go and take some time off. I often have to write support letters explaining exactly why it is needed. She's
Yeah.
just not making it. She cannot do anything. If I'm the consultant, I'm saying, you know what, you need scan every 2 weeks, or you need to go to the day unit for more blood pressure check or some blood test. That is, she is following that recommendation, but it is very difficult. So I have to write it down, write a separate letter of support explaining everything. Sometimes they listen, sometimes they don't. Often they, it depends on how considerate the managers are and how big the business is. Of course, you know, if they're small business, often they lose their job. I
Mm.
have seen somebody very recently who used to work in a restaurant, and she lost her job
Mm.
because, you know, she developed some medical complications, quite significant medical complication actually, when she needed most support. And of course, you know how the cost of living, etc., is nowadays. If you are just depending on your income, that is a source of income, and that is actually, now she's worried that how she's going to look after the child.
Mm.
So I'm not surprised that she ended up in having very significant mental health issues.
Yeah.
And so I think this is sometimes often not very much recognized area.
Mm.
So I think if someone is pregnant, and anyone who is listening to the podcast, if anyone who is pregnant, please remember that 1 in 4 moms can have mental health difficulties,
Mm.
and that can have an impact on their pregnancy outcome, their delivery outcomes, and also moving towards the future. And also, it is very important for the brain health of the baby. Often
Mm.
we do not recognize that. If the mother is going through a lot of stress and mental health difficulties which are not properly addressed, the
Mm.
stress hormone level cortisol can have an impact on the pregnancy outcomes, and specifically can have an impact on the first 1,000 critical days of the baby's brain. That is often we fail to recognize.
Yeah. And I think what's interesting about that aspect is this is before a mother is off on maternity leave. So majority of people working, and they become they're pregnant, they're at work up right up often, yeah, pretty much near up to the point that they're having a baby, and their time off is not until after. So actually there's that space where somebody's in work that needs that support. You touched on supporting letters. That's something I've come across, and one word comes out of that, and it's trust. And I think, businesses, any business, yes, we obviously, for recording purposes and potentially for records, HR, and to have a proper record of on someone's personnel file, there will need to be that letter of support for additional appointments and all the rest of it. I fully understand that. But I think for the individual, it can feel like they're not being trusted, and
Mm,
then there's that lack of trust, and that can damage relationships in the workplace. The person then thinks, I don't want to, I don't feel like I'm being believed, even if I have submitted a supporting letter.
mm,
And those types of supportive conversations are not happening where HR or anyone else is saying, it's okay, we only need the supporting letter for your record because it gives us the opportunity to provide that extra support to you, not because we're checking up on you. That so the,
uh,
the the key one there is trust for me, I think.
mm. Taking that point, I don't know whether it is practically or logistically feasible, but I think it comes down to one thing. You mentioned a very important thing is communication. I don't think there is a communication between the healthcare team and workplace and different other system of the government. I
Mm,
think there has to be more communication without compromising patient confidentiality at the same
yeah,
time.
yeah.
But there has to be some form of communication. In my view, everything is digital now. Even the tax is now they're talking about is complete digital and all those things. So and when we are talking about a digital healthcare system, I think there has to be some form of communication lines with their employers and the government, because sometimes they are supported from the different government funding, etc. So I think that if there is some innovative approach to open up those communications, so that they know that what is going on. I am not saying that you disclose all the everything that is going on
Yeah.
with your health, but maybe some way of saying that, she might need more appointments. She might need some, she is requiring more kind of hospital appointments or clinic appointments.
Yeah.
Just one point very briefly I will touch that when someone is pregnant and let's say she has developed mental health issues, now what is happening, so many appointments she is attending. She is attending her appointments with a midwife and obstetrician. She is attending her mental health appointments with a psychiatrist, psychiatric nurse, and you just name it. So her life is full of appointments, and when she cannot focus, that is going to affect her. Going back to the thing is quality of life,
Mm.
both at workplace and outside workplace, and that can be a vicious cycle. And we also, as a healthcare professional, need to ask. I specifically ask, both in my antenatal clinic as well as gynae clinic, that how it is actually affecting your life,
Mm.
how everything is going around, how it is affecting your relationship.
Mm.
Sometimes, in pregnancy, there is another very important topic is intimate partner violence.
Mhm.
It's often called as domestic violence because in pregnancy the rate is very high for different reasons. I'm not going into that today, but it's a topic in itself. So there are so many different aspects, and it brings in when someone is pregnant or going through sometimes in fertility journey. There's the same thing.
Mhm.
So yeah, so we have to.
It's funny you mentioned the infertility journey. I've seen a lot more employers and a lot more communication around that space more recently. Obviously, we've had the kind of menopause and perimenopause, but the infertility one I've seen around, time off being given and just a bit more discussion about what that means in a workplace environment and allowing people, that time and space to work through those challenges while
Hmm,
still being able to retain a level of functioning in the workplace and feeling valued, because often people going through these types of journeys, they don't want to leave the workplace or be
hmm,
signed off. They want to
absolutely,
continue and feel valued at work, but at the same time, they still need to be supported through that
supported.
journey.
Exactly. And absolutely, I agree with you. And interestingly, the funding is when we talk about the life cycle approach, there
Mm,
are support available for everything.
mm,
But when it comes to fertility, majority they have to get private help. There are very strict criteria. If you meet the NHS criteria, there is a very long waiting time. I see it every single day in my clinical practice. So they have to actually go out and fund their own treatment, which is very expensive.
mhm.
So when they actually need to work more, so that
Well, I was actually going to touch on that. Does that then mean that you're potentially seeing both parties, part of the couple, potentially have doing overtime? And doing more hours to try and build a pot of
I mean,
money to then, and it again it creates that vicious cycle. You talked about the pillars of health. We bring in another couple, and one is financial well-being
mm,
and spiritual well-being. Now,
mm,
financial well-being ties very, very closely into what you're just saying, which then means, do I need to do more hours? Do I need to get a second job, a third job?
absolutely,
You
exactly.
know,
Because
it's
otherwise it is hugely expensive. If you ask anyone who are funding their private treatment, I
Mhm.
see, they just often burst into tears if when I say that, you have to check with your GP whether you meet the criteria or not. Now, many women, rightly so, they are sort of delaying their fertility of pregnancy due to their career. But there are different ways to support them. So I think, in my view, life is changing, the society is changing. That has to be recognized because we are still sticking to those criteria which was set up 10-15 years ago when the digital world and so much women empowerment we are talking about. But actually I do not see it in the government policies. The
Yeah.
criteria is of the referral is same. There are age criteria, and after 40 there are your options get limited and all those things, but actually it doesn't reflect our modern society. Things
Mm.
have moved on, and women are very important. They play a very important role nowadays what they used to do 50-60 years ago. So we
I mean,
cannot.
that touches the other thing as well, though. I've never come across anyone talking about fertility issues in the workplace.
Hmm.
So the stigma behind it.
Significant stigma, significant. Often they actually do not discuss with their employers, etc. So I think that is why it is very important to have an open conversation.
Mhm.
That should not restrict you to talk about this. Yes, it is important. And often this, when I talked about the screening, there are different ways, like egg freezing and all those things, but many patients come to me and they want to explore those areas, that I would like to delay pregnancy, can I have this one, can I have that one? But that those kind of support, they should be provided, because individual should be allowed, regardless whether they're depending on their gender and etc. They are human beings, so everyone, their approach should be positive, and that should be supported by the society, government. Otherwise there is no point in saying that we are an advanced or modern society,
Mhm.
because individual approach is very important. But unfortunately I see that uh, this sort of criteria and so called, which I personally do not like, because you cannot generalize and have a blanket treatment, a criteria for everything.
Yeah.
Because for example, prostate cancer or breast cancer, for example, some individual are higher risk, so you cannot just draw a line, okay, before that I'm not going to do it,
Yeah.
after that I will going to start. But I might be worried. My mother might have had a breast cancer, or my someone has a cervical cancer somewhere. I would like to have screening early. So what is that individualized approach is needed, in my view.
Yeah. Yeah. Okay, I'm going to touch on a kind of a couple of last questions, just watching the time that we have available. If you could change one thing that would improve people's daily working lives at the moment, this is always changeable, but what would it be? What are you seeing that could make an improvement right now?
First of all, well, difficult to pinpoint only one thing. I would say, which applies to any stage of life cycle, everyone, is that having a healthy lifestyle. Healthy lifestyle, in my view, that is focused on four factors. There are different so-called pillars, but I specifically focus on four things. That is your physical activity. Doesn't have to be a regular kind of exercise. Any physical activity is counted towards your overall exercise thing. Second is nutrition. Third one is sleep. And fourth one is stress management.
Mhm.
And I think that should be, everyone should be educated right from the beginning. It's not that when I'm actually having been diagnosed with diabetes or high blood pressure or high cholesterol, I start doing that one. So it should be a part of every individual right from the childhood, the day they are born. I mean, I'm not saying that literally, but as we go along
Mhm.
throughout the entire life, that should be incorporated in the life. Now, this incorporation is very important. When I tell my patients that, what, you need to change this one, I can see that it is not, you have to improve your physical activity. So what they come back immediately say, Dr. Raj, I appreciate what you're saying, like other doctors. I cannot do that. I'm extremely busy. And this is exactly why you have to be innovative
Mhm.
in your life, so that it can be incorporated.
Mhm.
How? Let's say, for example, I'm extremely busy. I do not have any time to do physical activity. So what you do, to what I always say, that you break the cycle of sedentary habit. Because what I see, sometimes they come back and say, Dr. Raja, I go to gym every day, but I'm still having all the different other health issues. So you told me to do exercise, I'm doing it. Invariably you will see that he or she is doing the exercise, and then the sedentary habit, they're lying down in the bed or working in the desk for too long. That in itself is a risk factor. So you need to break the cycle. I said, what, you just change those habits when you're
Mhm.
at home. Just try to do something, break that cycle of sedentary habit. You
Mhm.
will see that immediately your life is changing. You
Mhm.
will feel better.
Yeah.
That will motivate you.
Yeah.
Often people say, Dr. Raja, when I come back after work, I'm a very busy individual, and I am so tired I can't do anything. If you look at the principles of lifestyle medicine, you might have heard, I'm a certified lifestyle medicine practitioner. Lifestyle medicine is a branch of medicine now, a new branch of medicine, focusing on an evidence-based approach of intervention with healthy lifestyle. So what I have seen that the evidence shows, and I have seen it in my own life. At one stage I was very, very unwell, and I was that is a bit counterintuitive. I'm very well and tired, and now you're asking me to do exercise. How can I do that? But if you do exercise, if you do break down those sedentary habit, you will see you're getting more energy. You are enjoying the life even more. Your aspirations are improving.
Mm.
So that is a different way of looking at it.
It is, and actually nice. I don't know if you have that in England, but in Scotland with social prescribing, that connects very well with social prescribing. I think we need more of that, actually. I think I just think it needs to be not only promoted more, but encouraged more, and more community spaces where people can go to for social prescribing. Because here in Edinburgh, for instance, you can get a 3 month gym membership on prescription. I would it'd be interesting to know with that kind of social prescribing what happens at the 3 months. Do about what percentage actually don't return and carry on? That'd be an interesting one, wouldn't it? But they're good examples. But yeah, we almost need to expand that. So you have 3 months free, 6 months half price, and it's almost like getting that because almost it cuts off at 3 months. You have all or nothing. You have that free 3 months of gym activity. Then they've got to pay full price after that. But there needs to be a little bit of a supportive journey for the individual to things like social prescribing.
And another very important approach should be sort of what we call as a health coaching approach. That is, health coaching essentially means that how we incorporate healthy lifestyle in our busy life. So, very interestingly, whenever we talk about intervention or any change in our life, any behavioral change, it comes down to two things. That is, one is your importance level, and one is confidence level. So we call it importance score and confidence score. Between 1 and 10, how do you rate yourself? If you see that if your importance level is high, your confidence level will improve automatically. They are very closely linked, not always, but most of the time. So if you know that, yes, I think that will help, we will do that. And that is the kind of thing. And that is exactly, it is not the fact that we don't know that we have to exercise. And I personally don't think that you have to go to the gym.
No.
Not everyone has time to go to the gym, to be very honest with you. But you can still make changes.
Yeah.
And that approach is very important. That I keep on talking about is this individualized approach. What is right for you may not be the right thing for me.
Yeah.
And it is definitely possible to make little change. That what Tesco says, every little helps.
Absolutely. Well, let's finish off with the final one. So we're a little bit kind of running over time, but it's absolutely fine. Given the current landscape, what still gives you hope?
For example, we are talking about it today. This gives me hope because it is not the fact, as I said earlier on, when I speak to the employers, they want to make change, but they don't know exactly what it is. So I think working together with the businesses, it is not right for any government or any policies just to be put on them to implement, but they should be supported. Should not be imposed in any way, shape, or form, and that is imposed on the employees. So, in other words, I think I can see changes, as you said that people are talking about fertility, they are talking about menopause, perimenopause, etc. It may not be perfect, but talking about it is a positive thing. So, whenever I see in the social media, LinkedIn, etc., I see people are talking about it. There are more and more people what I used to see 10 years ago. So that gives me hope. People, I see, you're talking about gym membership, etc. People are doing it. It's not that lazy people like me, they do not go to the gym, but people are doing it. I mean, I see in firsthand in my clinics, people are much more knowledgeable. Specifically the generation that are growing up with the digital, that they have more access to information what they used to have 10, 20 years ago. So people are more educated, they're more aware. So I am hopeful. When I'm talk to my daughter, she is much knowledgeable than health and well-being because they in the school they talk about it.
Mm-hmm.
So these are all positive things. Yes, they may not be perfect, but they talk about different things in the school. And my daughter is 14, but when she comes home, she gives me a lot of information, share a lot of information. I when I was 14, I didn't know about that. So they
Mm-hmm.
have more access, but at the same time, we have to be a bit mindful that a lot of challenges come through that as well.
Yeah.
So I think it's creating a balance. Education is key, but most importantly, working together as a team rather than I am a policymaker, I am an employer, I am an employee, I have got rights. But yes, you are. But I think together we can make a difference, in my
Yeah.
view. But at the end of the day, most important, first and foremost, is that individual, what we are talking about.
Yeah. Yeah.
Their voice needs to be heard,
Yeah.
I feel.
Okay, well, you heard that. The voice needs to be heard is a great part to finish on. Thank you so much, Dr. Raja, and we'll see everyone next time.
Thank you so much, Catherine.